Hey, it's Jessica DaMassa with WTF Health. I'm here at Bayer's G4A signing day, and we're talking to all of the startups. So joining me now, I have Edward. He is the CEO of BioLum Sciences. So you guys are disrupting respiratory health, which is really cool. You have a device. Tell everybody about it. What do you guys do?
Yeah, absolutely. So we've invented a device, really a platform built around some amazing chemistry, and what we're able to do is test for breath and blood samples in really a matter of minutes.
Okay, so how is this different than what's usually being done to test breath, and what are you testing for?
Yeah, absolutely. So really kind of the standard with respiratory healthcare has really been using technology that's been around for, I don't know, since about the 1850s. Oh. Yeah, so really over the past 10, 15 years, there's been a lot of advancements in terms of really just kind of looking at chemicals in the breath. But what we have is not only easy to use, it kind of takes patient involvement out of it, So, and I guess one of the big things too is that it's accessible. The technology we're using is commercially available in so many different settings. So,
all right, walk through the chemistry part of this for me. So somebody inhales into your device, and then the device is testing for what, and what is it like? What is it trying to figure out if you have? I think you guys are in asthma. Is that right?
Yeah, absolutely.
Okay. So. Go ahead, explain it.
Of course, yeah. So really what we're looking at is airway inflammation. When you have asthma, COPD, these airway inflammatory diseases, you're emitting certain chemicals. Specifically, what we're looking at is exhaled hydrogen peroxide. Okay. It's elevated in people who have really varying levels of airway inflammation. So we collect a breath sample for about a minute. What we're actually doing is we're cooling the breath as we collect it. So we're actually collecting exhaled breath condensate. If you ever wear glasses, you know when you go breathe on your glasses, there's a bit of fog. We're collecting that for about a minute. Then we're actually adding that liquid sample to a chemical solution. So as the two mix, there's a reaction and an emission of light, which we measure with our product.
Wow, that's really cool. Okay, no, I'm glad you broke that down for us. And so this is a novel technology that you guys have invented. Mm-hmm. And so is this patented?
Yeah, so we have a patent filed. We just sent it out to the International Search Authority. They came back and told us all claims on our patent are novel and unique. So we've got a fast track moving forward, at least over the next year. We'd ideally have our patent complete.
Okay, and so by detecting these certain chemicals in that condensation or seeing that chemical reaction happen with the fluid, you're able to diagnose asthma. What else are you able to diagnose?
I guess what we really want to focus on is not necessarily diagnosis, but really monitoring and managing. Okay. Regulatory-wise, and as I'm sure you understand, it can get a little tricky. What we're also focused on right now is actually hypertension. So that's why we focus on now blood testing. But really, as far as the breath testing is concerned, is really asthma, COPD, other inflammatory airway diseases.
Okay. So how does this work with blood?
So once again, we have our core chemistry. It's a different chemical solution, but more or less it can interface with the current platform. So what we're doing really is taking a drop of blood, adding it to a chemical solution, and watching the reaction between your blood and our chemical solution. Okay,
I love this science, but tell me about the business. What's going on in the business? Where are you guys at? You're a small company, you're growing. You guys are not in the market yet, obviously, because you're still going through tests for this. So give us a sense of the business. Are you raising money? Where are you at?
Yeah, absolutely. So we've been at least focused on raising money, a seed round this year.
We 3 guys, right? Or 4?
Four of us, yeah. So 4 co-founders. We all met actually at college, at university. The 4th co-founder who's not here is actually a professor at the university, a chemistry professor, so there's kind of the genesis there. But yeah, we've really made some great strides in terms of the breath analysis. I would say that's a little further along than the blood analysis. We did a pilot study this year in human, got some really great results there. We've already met with the FDA. We've confirmed our pathway moving forward for that. And then really what our focus on now is to push these 2 projects together simultaneously to some degree. So as I mentioned, the breath is a little further ahead of the blood. But yeah, I think we could reach the market in about a year and a half with the breath analysis, and then blood analysis takes longer, but very exciting nonetheless, and we've got some really great momentum already on that.
Okay. What brings you to this Bayer G4A event? What prompted you guys to sign up for this? What was exciting about it? It sounds like you're pretty far along.
No. It's you can always use help. But Bayer has an amazing reputation, not only as a company, but more specifically with kind of what they're doing in terms of respiratory medications, things of that nature. So not only do they have technical expertise, that's great, they have some really amazing products, really amazing drugs that are coming out into the market. And what we really like the idea of is having our product used alongside these drugs, not only to validate the drugs, but as a means of validating BioLum Sciences, validating our technology, and really all the things we plan to invent. So.
Awesome.
Yeah, really great.
Congratulations. Excited to talk to you. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.